I'm interviewing Eugenia Nadolu for the project Connected for Health, which is an Erasmus project dedicated to medical and humanistic approaches to treating obesity and eating disorders. Good afternoon, Eugenia.
Hello, good afternoon, Jonathan. And I'm glad to invite me in this interview and count on me with this project.
Well, it's a real pleasure to interview you, and I've been delighted by your participation, your collaboration, your help for me. But can you explain a little bit about your post and your position in Son Espaços Hospital?
Yes, I work as a psychiatric nurse in the pediatric mental health unit in a hospital here in Mallorca, in Palma de Mallorca. The name of hospital is University Hospital Son Espaços, and it's about a small unit, you know. It's a unit only with 11 beds, and it's the only one in Balearic Island. Psychiatric, is pediatric mental health unit. It's really, in the last years, we have seen increasing cases of kids and teenagers with mental health problems, especially eating disorders, suicide, self-injury, and above all, emotional dysregulation. There is the problems that we are finding every day in our unit.
So it's a small unit, but you have a lot of work. So
yes.
It seems to me that the problem in Spain, from your point of view, is a very big problem. Is this correct?
Yes, exactly. Only from point of view, from our point of view, from Mallorca, and maintain in contact with another units of rest of Spain, is the same situation. The cases with teenagers, especially teenagers with mental health problems, are increasing a lot in Spain, especially after the coronavirus pandemic and lockdown. That is true. That doesn't mean that pandemic and lockdown did it, you know. We are sure that before the coronavirus pandemic and lockdown began, these problems with teenagers and teenagers with how they handle their emotion and their problems, emotion dysregulation.
Why do you think it's grown so much? I mean, obviously the pandemic is a problem, and the lockdown was an enormous problem, not only for teenagers, but for many people, and in mental health. But why? You said that it's a deeper problem. Do you have any reasons for this?
I think there is a lot of causes. It's not only one. In mental health, normally there are a lot of reasons to produce a disease or a suffering. One of them, we think we talk about generation, Zeta generation, they said, with a low frustration tolerance and short-term hedonist. There are people, teenagers that with low tolerance, and medias as Instagram and
social media.
Social media. Yes, they have much to do in this general contagio.
Infection, like infection.
It's like infection. Yeah. It's like infection, because in this age, they are very vulnerable, and it's as an infection, and in this
generation. Yes. in the
Exactly.
generation or the Z generation.
That generation.
The short-term hedonism is very interesting.
Yes.
Can you explain what the short-term hedonism means?
Yes. I try. I try to understand and I try to explain in English. You know, we are living most of all in Spain and in the developed country from Europe, when the family, parents, they have all that we need. And when our children need something, we used to give them immediately.
So everything is handed on a plate to the children. They have everything.
They haven't to wait so much, because it's very important when they grow up to handle with this moment, waiting, not to do everything immediately.
This is very, very interesting, Eugenia. And I know about the fantastic work you do in your unit. Maybe you could tell us more about what you are doing in your unit and why you're doing it.
Yes, of course, and thank you. With the teenager that are admitted in our unit, we have a lot of problems, difficult to express. The teenager the teenager are a lot of problems to express their emotion.
Yes.
To express this emotion. In the conventional or traditional therapy, you know, face-to-face with a nurse, mental health nurse, or psychiatric or psychologist, they are very difficult to talk to them, to tell them, to explain what they are feeling, why they are suffering from. Okay, and for this reason, the psychiatric nurses in our pediatric mental health unit use other techniques. We are searching another techniques to be more near about the suffering from the children and teenager. When these techniques would explore the non-verbal expression as art therapy.
This is fascinating, Eugenia, because you have mentioned to me many occasions the difficulties that these teenagers, but teenagers in general, even
yes, teenagers in general, exactly. They are close. In this age, they are close, and they are very difficult for them to express what they are feeling, you know?
So how does art therapy help these teenagers who are obviously suffering a great deal?
Yes, the arts, like a non-verbal expression, encourage the exploration and the expression and communication of aspect of we are not aware, they are not aware of this. Painting are records of stories and experience in images, okay? And they can choose the color unconsciously according to the dominant emotion. That means that with art workshop, we are help the teenager to be aware from this suffering, from their emotion, and step by step, fluidly, to go out
to let their emotions come out. Yes,
to let their emotion come out, exactly. And after this workshop, it's more easy for them, for us to talk to them.
Can you explain the process of the workshop? What happened?
Yes. Normally the workshop are 1 hour. We cannot do workshop more large, you know. Normally the young people, they need all very fast.
Yeah.
But how is workshop How is also we can manage during approximately 1 hour. And normally we started in circle, the psychiatric nurse and the other patient sitting in the chair. We begin to speak about emotion. What emotion are they for? There is not good or not bad emotion.
Okay.
Every emotion has their function.
Their function, very good.
Yes, every emotion has their function. They are not bad and good emotion. And this is okay because most of them thought be anger, be upset. That is a bad emotion. Now, emotion, it's important to put word, and it's important when come.
Yeah. So every emotion is important. So
Every
you
emotion
start
is
with
important.
a circle explaining about the emotions. And the next step.
Exactly. And the emotion that we realize that it's a very common emotion in teenagers, they are admitted in our unit, is anger. Anger is very strong emotion. It's a very strong emotion. It's mobilizing more than be depressed. It's better to be angry than be depressed. Because when you're depressed, you cannot move because there are not energy.
Yeah.
But when you are angry, yes, you have a lot of energy, but somebody, a professional, help to direction, to guide this energy. And so we used to work the anger as a main emotion. And we invite the patients to invite to close their eyes, and few minutes, only few minutes, 2 or 3 minutes, to connect with recently emotion who produce anger in their family. It's not necessary to talk about it. Not only to think it, to review, maybe to this experience.
I understand.
Okay. And when they are ready, when they are connect with this emotion, okay, we begin the workshop. We put a long paper in the floor, and we use a special paint. It's for a finger. It's to paint with the hands. It's very important to involve the body. The body in this exploration of the emotion. Okay, and everyone choose the color. We put a lot of colors, the paint with a lot of colors, and everyone choose the colors that inspire. They choose this. They choose normally very quickly the colors because they are it's very directly this emotion.
Very interesting. Yeah.
Yes, they choose very quickly and paint.
Fabulous.
It's very important, and we tell this directrice, no picture, no, it's only abstract, because if they paint something very precisely, they can connect with the emotion, with the trauma, and it's very
disturbing for them.
Exactly. It's no image, only directly, only abstract.
And what are the results?
At the beginning, most of patients, normally patients with eating disorder, they have not. The patient with eating disorder, they are very thin, because most of trauma are fixed in the body, not only in the mind.
Yeah.
Exactly. And the patients with eating disorder, don't feel emotion because of lack of body.
Yeah.
Stop eating causes extreme thinness.
Yeah.
So there is not enough body to feel emotions. And for this reason, the patient with eating disorder suffer the name alexithymia.
Yep. So the results of the art therapy brings out the emotions.
Brings up the
And they
emotion.
can talk about the emotions.
Yes, exactly. Most of the time, under a fragile body are trauma unresolved. And they prefer, the patients with eating disorder prefer feeling nothing, instead of feel or bad feelings.
This is fascinating, Eugenia. Unfortunately, we need to stop the interview, but can you give me kind of a sentence to explain why you think this art therapy is so important?
I think really it's very important because I've seen how the patients respond after the art therapy or during the art therapy. Because if they want to talk to them, most of times it's only silent. It's only silent, and it's better that silent, because in this way you can help them.
Thank you, Eugenia.
Thank you to invite me, Jonathan.